Why are these people marching through the streets holding protest signs? They are marching for you. Senate Republicans have been working in secret to suddenly spring a Senate version of the House AHCA bill to a vote, to repeal and replace the Affordable Care Act under stealth. We know the House plan was awful and would cause 24 million Americans to lose their health care over 10 years. But the Senate Republicans have been so secretive that we don't currently know what will be in their bill. What we can say for sure is that the Senate bill cannot be very far from the House plan because they are trying to pass the bill with a simple 51-vote majority using the reconciliation process. And we already know a lot about the House plan. Trump Care would impact almost all of us directly. If you have individual coverage, 24 million will lose it. Costs will go up 15 to 20%. Even higher than that, the older and more rural you are. West Virginia, right? If you have coverage through work, 7 million will lose that. And we have just learned that West Virginia will lose 10,200 jobs of all kinds if the AHCA is enacted, and not just jobs that are directly related to health care. Federal protections outlawing lifetime caps will be gone. If you're on Medicaid, the budget for that will be cut by 25% and then capped. Because of this, kids, seniors, disabled, and the low income will lose coverage and lose health care. If you or an aging parent live in a nursing home, you are in big trouble. Half of nursing home care is from Medicaid, which costs over $100 per day. You and your family could face financial ruin. Have a pre-existing condition? Most of us do. Federal protection against charging more, probably a lot more, goes away. Still don't think you're affected? Healthcare is very interconnected. Have kids or grandkids who go to school with other kids? 3 million of them will lose insurance. Are you or a loved one a veteran? 40% increase in uninsured veterans. State budgets will be cut by billions in each state, and West Virginia is already in a budget crisis. Concerned about opioids or mental health in your community? Tough. Think you're too young and healthy to need it? You will need health care at some point. You just won't know when, and you will be shocked at how expensive it will be when it is too late. Don't think you should have to pay for someone else's health care? Really? Then you don't believe in insurance, because that's how insurance is supposed to work. You pay in when you're not sick. Insurance pays the bills when you are sick. You can't predict when or even how bad your need will be when that time comes. So there's no way you can just buy what you need, because there's no way you can know what you'll need. But it is dead certain that you will need health care at some point, especially when you get old. The big problem in the U.S. is that our system uses private, for-profit insurance companies, which cost us twice as much as the systems used by most other developed countries in the world today. So again, why are these good people marching? It's because something bad is about to happen, and these good people are stepping up to try to stop it. Vigilance Jefferson County regularly contacts our congressional representatives to voice our disapproval of the AHCA. But sometimes we have to do other things that raise public awareness as well. On June 4th, 2017, Vigilance joined forces with the Women's March on Washington, West Virginia chapter to dramatize the problem with our 200,000 Steps March. Each step represented one of the 200,000 West Virginia citizens that will lose benefits if the AHCA is signed into law. The 75 protesters completed 110,250 steps that day. Who could save us from the AHCA? Senator Shelley Moore Capito could help if she wanted to. Senate Republicans need 51 votes to pass this by reconciliation, which could not be stopped by a filibuster. They can only afford to lose 2 Republican votes. Since Senator Capito has expressed reservations, she could be one of the 3 people who could stop the AHCA. Some experts are even saying that she may be the most important senator right now. For a while, Senator Shelley Moore Capito said she would not vote for any bill that would reduce Medicaid, but recently she changed her tune. and now is willing to accept ending Medicaid expansion over a 7-year time period, which coincidentally gets her past her next election in 2020. This leads us to expect that the real issue is not what is best for West Virginia's citizens, but what is best for Shelley Moore Capito. Senator Capito, those two are the same thing.